And yet, on a daily basis, citizens continue to experience significant challenges as they try to access health care at our nation's public institutions. I want to deal firstly with a power outage that occurred at the Eric Williams Medical Sciences Complex earlier this week. Earlier this week, we were informed of a major power outage at one of the nation's largest hospitals, the Eric Williams Medical Sciences Complex, which is the flagship hospital for the NCRHA, the North Central Regional Health Authority. We were told by a newspaper report, and indeed from a release by the Corporate Communications Department of the NCRHA, that this was caused by a malfunctioning transformer, which apparently had been repaired just 2 weeks earlier. As a result, load shedding had to take place in all non-essential and non-critical services to mitigate against any problems in the emergency areas. This is what the release went on to say. At the end of the day, some 8 patients from the intensive care unit at the Eric Williams Medical Sciences Complex had to be transferred to the Arima Hospital, and a number of patients who were having renal dialysis had to have their renal dialysis curtailed, and indeed the service for renal dialysis was postponed the following day. I just want to say that a patient who is in the ICU is already quite ill, and to have to transfer such patients from one institution to another, while this is not unknown in times of war and war zones and so on, in times of crisis, to have a situation like this occurring when, due to lack of maintenance and other issues which I'll come to, is rather worrisome.